Welcome to the latest episode of the Parent Palette podcast. Today, we are excited to chat with Dana Hardy, the Executive Director of BeginNet India and a founding force behind the Association of Lactation Professionals India. Dana is an IBCLC and childbirth educator in Dehradun, where she's all about supporting families with evidence-based advice and empowering them through pregnancy, childbirth, and beyond. She's passionate about bringing the medical community together to make breastfeeding support accessible for everyone, with a dream that every family gets the education and care they need for a great start. Welcome to the Parent Palette podcast, Dana.
Thank you so much. I'm so glad to be here.
Great. So to start off with, Dana, let's hear your story of what inspired you to transition from your personal breastfeeding journey to founding BeginNet India.
Yeah, so my personal journey, which I've heard commonly in many of our students and graduates and lactation professionals in India, it really provides that why.
Okay.
So I come from a medical background and I have experience working in the hospital setup, but I knew once I had my own children that I would want to shift to maternity childcare work, right? And so my first baby was my son, and I just had so many challenges in those early weeks and months. And I just thought, I am a nurse. Why is this so challenging for me? But
Right.
I always joke that he made me a lactation consultant because I'm a researcher. I love to connect with people. And so through my journey with him, then the second journey with my daughter went a lot better, but we added something more complex to the mix. When she was 3 months old, we shifted to Dehradun. So shifting to Dehradun in India from Chicago was a whole different complexities and challenges. But because of my work and just relationships in the community and just hearing the common questions of like, why is she so healthy and only on your milk? No formula, no top feed, nothing else. And I just kept hearing that over and over. And so I thought I was relocating to a place where it was going so much better than the US, right?
Okay.
But I've learned that this is a global issue, right? And so the beginning for so many families across the world does not go so well.
So true.
And so I wanted to not only help the families in my community and support them, but also get the highest level of training to support people across India and around the world. And so my own training led to the birth of BeginNet India, because what I realized was, okay, I'm a mom of young kids who wants to get this training in lactation, but my one course, I had to go live in Delhi for a week and I was still breastfeeding. My other course was in Mumbai and I was still breastfeeding.
Okay.
And then some other courses were US based and were at such a high cost that I knew it wasn't accessible
Right.
to everyone in India. So that was the vision and the dream, because I believe that it is, a right for families to receive skilled lactation care. That doesn't mean that they only breastfeed.
Right.
And that doesn't mean that breast milk is the only solution,
Right.
but receiving that skilled care just helps us begin in such a better way. So that was, my personal journey coming alongside my own professional journey. And then it's grown to this community response and
Right.
a social movement response of especially women. Yes, we have some men who are lactation professionals, lactation consultants, especially pediatricians, but mostly 98% it's been women
Right.
who say, I want to be the solution. I, one, didn't have such a great situation, or two, I had a great situation, or three, who's providing this care in my community. And so seeing women come together to
Yes.
support healthier families in India has just been such a beautiful dream. And seeing it accomplished is not through my work alone, but through that team and through that greater work across India.
it's amazing how your personal journey has led to the founding of BeginEd. In fact, I think a lot of us, right, a lot of us lactation professionals have begun like that due to our personal experiences and the need to do better, the need to give back to the society. For those who aren't aware, even I have done my course with BeginEd, and if you are looking to be a lactation professional, you definitely need to reach out to Dana for that. So Dana, building a support network for lactation professionals in India must have not been an easy feat. Could you share some of the significant challenges you have faced in this process and how you managed to overcome them?
Yeah, I would say we are doing a lot better and the community has really grown. But when we think about barriers, we have to think about it from a multifaceted way, right? And so we have systemic barriers where it is the healthcare system, it's policy and public health system.
Right.
It's the individual level where families don't have access to care and services, or families take their own choices. It's access to training in order to grow in this profession.
Yeah.
And then, you know, it's not just lactation professionals who are providing this work and care. In the hospital, that's especially nurses. And so we can think about some of the barriers they have to providing skilled lactation care with a high caseload, with lack of resources in their workplace. And so when I was considering just all the dimensions
Yes.
of those barriers, there's not just one solution, and not just one person can play the role of, you know, creating the solution everywhere always. And so that is when I was through with my training and I said, who else is doing this work? So luckily I'm not too old. I'm only 42. So I Googled best lactation consultant in India, best lactation consultant in Delhi. And so that's when I met Dr. Shachi Baweja.
Okay.
And I said, who else is doing this work in Delhi? It has to be better than Dehradun.
Yes.
Dehradun, I can't find other lactation consultants. And so she said, I have this Italian friend. And I said, well, I have this friend from my course. And so that was the birth of the Association of Lactation Professionals India. And so I think the community response and us being in this process together, we can take on different levels of barriers, right? And some of us are better advocates. Some of us love advocacy work, policy level work. And yes, we need to do that work together. And that work never stops. Some of us are better practitioners. So we come alongside families and have high caseloads, and then we can give a better reflection of how this work is going. Some of us are better at organizational management. And so developing organizational processes so that when we grow, we can support each other. And so I think we are doing pretty well, but there's always room for growth. And the world changes. In the middle of doing this work was what? COVID. And we had to adjust and we had to come online and we had to do virtual consults. And so I've seen lactation professionals be versatile, be agile, be willing to flex. And, you know, some of our wiser lactation consultants and professionals came to WhatsApp and internet later in life, right? And so they've had to adjust through using those methods, those tools. And so I hear them communicate, you know, with someone who's 25, and that's been earlier in life, and just learning from each other. It's not like I'm wise, you listen. It's that picture of wisdom is shared across the lifespan. So I've been really encouraged by that, especially.
So collaboration actually seems to be a big part of what you do, and I'm sure it makes a bigger impact, not just within the lactation community, but also by including other healthcare providers. So what does effective collaboration look like in this space when you say that you want to include, you know, more doctors, more pediatricians, gynecologists? So if you could just elaborate on the importance of referral networks in lactation work.
Right. Yeah. And so there's two C words when we think about how to work in partnership. There's competition and there's collaboration. And so I have always appreciated the word collaboration better, because that means a mutual relationship, right?
Yeah.
And so when lactation professionals come to the field and they say, I'm the only one, I often take that conversation bigger, because I say, you will be in this field for some time, and you will be in this field and then you will leave. And
Right.
you are not the only one. Every day, pediatricians support families. Every day, physiotherapists support families. Every day, nurses support families. So you need to open your eyes wider and consider how to build a referral-based team. And so when you think about the work you do, it's not just, I'm the only one.
Right.
Instead, there is this team that is coming around you, and you don't work for the team, you work with the team. And
Right.
so that is really important, because we are supporting families with pediatricians, right? Families come to us. There is breastfeeding happening, but there's also top feed happening, and
Yeah.
the family's goals are happening. And so how do we come alongside that medical plan where there is top feed, and then the skilled lactation care plan where we're trying to decrease and, move towards the family's goals? And so we need to think about that as a team situation, because ultimately families leave our office, our clinic, our consultation room, and they're going to make their own choices.
Correct.
And so remembering that we are supporting their journey, not, oh, it's our outcomes. And so that ownership changes, right? The ownership shifts to the self-efficacy of the family,
Right.
and their ability to support themselves. And so we can support them with skills, with some tools, with some knowledge, and we can work on a team with especially pediatrician, OB-GYN, nurses,
Right.
but seeing them feel empowered, because we want them to be confident, because we know to overcome challenges, it takes courage, it takes confidence, and we're not with them all the time.
Right.
I don't know about you. Maybe
Yeah.
Sapna provides 24/7 care,
No, I
but
don't.
most of us have limits, right? So
It's impossible. I can't be available 24 hours, but yeah.
yes, and it's not wise either.
Yeah. Okay, so when you say that, we need to include, other professionals as well, because, even as lactation professionals, our scope of work is sort of limited. Like, say, for example, there's a tongue tie, or, there's an abscess, and they might have to go in to meet the gynec, or, various reasons why they might need to consult another doctor. But I think, I'm not sure if you have come across disagreements. I'm sure you have, but a lot of us do encounter disagreements with respect to breastfeeding with other medical professionals. It's very easy that if there is a problem, they immediately blame it on breastfeeding, and they ask the families to stop breastfeeding. So how do you think
Right.
lactation professionals can actually navigate, differing opinions or care approaches among team members, or within even
Yeah,
the broader healthcare team?
that's a great way to say it. Differing opinions, right? So we can't say, oh no, why? Why did they tell you that? That's terrible advice. Like, we have to have professional support of each other.
Right.
And so those conversations don't need to shame the other provider, right? We're going to have differing opinions. And so we have to learn communication skills in a way where we're not causing the family to doubt the support of other providers. It could be another lactation professional. It could be, like you're saying, maybe a tongue tie treatment provider.
Yeah.
And so if we don't agree with the plan of care, then we need to navigate that very sensitively. And so I always remind our students, our grads, LP members, that lactation professionals need the team, because we don't diagnose,
Yes.
prescribe. And so if we think, oh, it's me, the only one, and I'm going to save all of these families' breastfeeding journeys, that is a lie, because
Yeah.
there will be a time when a family has mastitis.
Yes.
And that mother has a swollen breast, and it's red, and it's not improving, and she needs an antibiotic.
Yes.
So we have to refer. there will be a time where we assess, I say assess, not diagnose,
Yes.
an oral restriction. So when we see under the tongue, oh, I'm observing an oral restriction, I'm doing an assessment, and I'm noticing a restriction, and I'm also observing the functional situation with the family where breastfeeding isn't going well and there's no sustained latching.
Right.
I'm not saying to that family, I diagnose a tongue tie.
Yes.
Instead, I change my language and I say, I assess some challenges in how the tongue is moving.
Right.
And so we have providers in our community who help with what we call oral restriction. So I want you to go for an evaluation and let them observe the tongue and the movement and the latch. And yes, I will still support you in the lactation journey, but I think we need some help here because there's not the sustained latch. And I'm noticing, look here, show them, look here. And
Yes.
show them a normal frenulum, but then show, okay, look, this looks here. Do you see this? We don't want to be an alarmist and scare families because they might not ever go be evaluated in the next stage, right?
Right.
So we want to coach them with not scary language, but supportive language. So then they follow up with our friend across Pune,
Yeah.
who releases tongue ties and
Right.
diagnoses tongue ties and lip ties and can do that from a professional way. So I would say that's how language really matters in the work that we do.
Right. Right. Shifting gears a bit, let's talk about the families. What are some common barriers families face in accessing lactation support, and how does BeginEd India work to address these challenges?
So when we birthed and began BeginEd India, it wasn't only to train new lactation professionals, but it was also to do the work in Dehradun. So we are a city of, almost, I don't know, it depends on what you count, but around 1 million people, let's say.
Okay.
And what I was noticing is there wasn't an awareness. If I said, I'm a lactation consultant, it was just confusion, right? So then I had to learn in Hindi, stanpan and salakar, and I would just describe it in all these ways because it wasn't a general awareness. And so BeginEd India not only believes in supporting individual families, but also public awareness and promotion. And so we have been doing trainings in the community with ASHA workers, with nurses. Just this last Friday, we were with 75 women from 15 to 60 years old, some aunties. And our team said to me, how can we do a session on lactation support training to 15 to 60-year-olds?
Right.
And so I said, we can. And so reminding them of the breastfeeding benefits, and the benefits to the infant, to the family, to society, and then doing just some basic skills where if a family in their community where we have high C-section rates, how do they initiate breastfeeding? How can we support with position and latch? How do we discuss effective milk transfer, even at the community level? And so I think it's not only supporting families, yes, definitely, but also bringing the community around families so that it's not a quick solution. Baby cries, not enough milk, give top feed. You had operation, you can't move, give top feed. So yes, top feed is required, especially in the NICU, especially in high risk situations, but it's not every family's need and requirement. And so having a public awareness about that allows us to make different choices. It could be step 10, but let's try some things before that. And let's come around that new family in the beginning and not say, because what do moms hear, right? What do new parents hear? Not enough milk, you're broken, you're doing a bad job.
It's sad, but
and
yes,
so
that's
whatever messages in any language, in any culture that we can say, look at this baby, they're growing, you're doing amazing. Like it really matters because don't need to hear those shame words. We're already in our own minds, 2 a.m.
Yes.
I'm broken. Milk, I'm harming my child. Like, we're already doing that to ourselves. So
I know. Like you said earlier, you know, the words do matter. The wordings actually matter a lot. Yes.
yes.
It's been amazing, Dana, to learn about your journey from your breastfeeding experience to starting BeginEd. And thank you so much, actually, for starting BeginEd and the wonderful work that you all are doing through BeginEd. Before we wrap up, are there any final thoughts or messages you'd like to share with our listeners, especially those who might be on the fence about seeking or providing lactation support?
Yeah, so I always think about it this way. I like this has become my motto: until all families receive skilled lactation care. And so I want families to know there is this service, there is this care available to them. And even better after COVID, because we do it even more virtually. And so even if they're in a place where they're not finding the services, we can do it virtually. And so you can be supported. And so whether you're pregnant and this is your first child, whether this is your second child and it didn't go well the first time, take a consultation. There are people all over India providing support. And then for lactation professionals, keep growing in your skills, keep building your team. We are not in this work alone. And if you're someone who is a new family, it's going well, it's going horrible, but you say like, actually, I want to help families. How do I do this? We can help you.
Yeah.
And we hear that story so often.
Yeah.
And so I really believe that it's not just about breastfeeding. We gather around the topic of lactation, but it's truly about healthy families and amazing beginnings. And so I just hope that this work continues to grow. And it's not only lactation professionals, but birth workers, midwives, OB-GYNs, pediatricians. Like, I just want to stand in this room in somewhere in India. It has to be a pretty big hall.
Yeah.
And light a candle together and say, we are bringing hope to communities and we are making change. So I think those would be my closing words.
Here, here. I hope your dream comes true and we continue to support families as we move on. Whether you're a healthcare provider, a parent, or someone interested in learning more about lactation support, we hope you have found this conversation as enlightening as we have. Remember, seeking or providing lactation support can make a world of difference, and effective collaboration can enhance the quality of care we offer. Thank you so much, Dana, for sharing your incredible journey with us today. It's clear that perseverance, collaboration, and a commitment to evidence-based care, you and BeginEd India are making a significant impact in the lives of many families.
Yay!
Thank you for tuning in to the Parent Palette podcast. Until next time, take care and keep supporting the journeys of families with care and compassion.